I don't do the shock jock stuff and all that other nonsense. Okay, so we're live, and I'll go ahead and set it up, and then we'll talk. All right. Good morning, and welcome to the Light Live. My name is Raymond Tyler, and today we're going to be talking about the health disparities in the Black community and how this is hurting people of color with regards to COVID-19, specifically in the Atlantic City, South Jersey, and New Jersey areas. I want to send a shout out to everybody at the Center for Cooperative Media for Ethnic and Community Media in New Jersey for their fellowship and their sharing of resources so that I could do this project properly with the resources that I needed to make sure that this has been a success. Right about now, via Zoom, I have the privilege of talking to Dr. John Regis. And what I'm going to do is I'm going to ask Dr. Regis to introduce himself and tell us about his practice. And then we'll get into the health disparity discussion and how that relates to COVID-19. Good morning, Dr. Regis.
Good morning, Mr. Teller. How are you?
I'm great. Could you tell us a little bit about your practice and how long you've been here in the Atlantic City, South Jersey, Pleasantville area?
Well, as you said, I'm Dr. Regis. I'm president of Reliance Medical Group, which I'm proud to say is one of the largest independent medical groups in the state of New Jersey. And we're also one of the largest majority African-American owned businesses in the state. We're primarily based in South Jersey, although in the past we've run and owned practices all over the state. Right now we have about 22 different practices in 5 South Jersey counties. We're in Camden, Atlantic, we're in Ocean County, Monmouth County, Essex County, and soon to be in Cape May County. I run Reliance now. This is my 35th year. I'm originally from North Carolina. Went to undergrad, grad school, and medical school at the University of North Carolina in Chapel Hill. And I'm the son of a proud son of an Army veteran. My father was 30 years in the Army and actually served, and on his headstone, he served in World War II, Korea, and Vietnam. So I have as much right and more right to speak on what's going on in this country, probably than most.
All right. Well, again, I want to thank you for taking time, your busy schedule, to be with us this morning.
Let me might add. Let me. One thing I didn't mention is that Reliance right now, and since we're going to be talking about COVID, and I didn't mean to cut you off, but I wanted to remiss if I didn't mention that we actually are working with the city of Atlantic City. We have a contractual arrangement where we are actually staffing two of the only COVID testing sites in the city of Atlantic City. One location being at Bader Field and the other location being in front of the Showboat parking lot. We've been doing this now for the past 2 months and have another month to go. The Marty Small administration and the city council, including Kaleem and others, have reached out to us because of their concern and the lack of testing in the city. There was testing being done in the county, but nothing was being done in the city of Atlantic City. And of course, the city of Atlantic City has certain challenges that other areas of the county, certain challenges, and I might say also certain advantages that other areas of the county didn't have. So they reached out to us. They've known us for a number of years, and we've been successfully with our staff manning and testing residents of Atlantic City for the past 2.5 months.
Wow. Okay, well, thank you very much. I did not know that.
Oh yeah.
Okay.
So, we're heavily involved in COVID.
Well, nationally, it's being said or being reported that like cancer, diabetes, high blood pressure, just about everything health-wise that is bad for you. Black people are being hit disproportionately hard, and the same is going for COVID.
Yes, it is. And, it's interesting because this is a never-ending story, and maybe when we have more time, we could talk about this never-ending story that I don't think it's ever going to end. But I don't want to be pessimistic. But back in the day, I used to give a presentation called medical racial profiling, and that was before the word disparities came out. That's how far back I go.
Okay.
And I used to talk to members, and I had a PowerPoint presentation. It wasn't PowerPoint then; we were doing slides or projections. And I used to put up a slide that said that out of the 21 leading causes of death in this country, that Black folks lead in 20 of them. So out of the 21 leading causes of death, Black folks were in the lead in 20 out of the 21. In fact, I think sometimes it's a wonder that we still survive as a race. So what you're seeing with the disparity and with the more definite impact in the Black and brown people community, it's just a continuation of the same old thing that's been here since we've been on the shores of this country. And that is, and there's a number of reasons for that. And particularly when it comes to COVID, the virus, I don't know if it's more, if Black folks are more susceptible. And by the way, from a genetic standpoint, that still has to be proven out. Nobody knows yet. You got to understand, COVID SARS-2 is relatively new. We've only been dealing with this since February. We don't even know how long immunity lasts. This is one of the reasons why all this talk about vaccines and that's going to be a cure. And I'm not so sure, because right now reports are coming out now that people, the immunity, natural immunity, can go away within a month, and you can get COVID again. So we just don't know where we are, and that's one of the problems. But essentially, why I think that there's such a high prevalence of COVID in the minority community is because, first of all, the bottom line is poverty, living conditions. A lot of Black folks that are working, now we do know they are essential workers. We didn't have the luxury of staying home and going online. When you are a sanitation engineer, and one of the most important things that is done in this country, one of the most important things that is done in this country is collecting trash. When you can't do that on your computer from home, you got to get out in the community. When you are servicing and orderlies, and you are LPNs, and you are hospital workers, and not doctors and nurses, of course, they're there too, but the folks who are cleaning the rooms, who are moving patients around, that predominantly a lot of African Americans and brown people are employed, we didn't have the luxury of staying home. So we were in these essential, and it's interesting now that we say essential workers. And I love what Joe Biden says, and I'm not being political here, when he says we call them essential, now we should pay them like they're essential. I love it. But so you had a confluence of forces, traditional poverty, traditional underlying medical conditions that made you more susceptible to COVID, our inability to separate ourselves from our jobs that fed our families, all those things came together to make communities of color more high risk. And so what you're seeing is years of systematic race and poverty and lack of access to healthcare that is coming to fro in the reasons why we are at such at risk for the COVID virus. But let me just back up for a second. You got to understand, the most people who get COVID virus in this country and that die are white Americans. So if you look at the healthcare expenditures, I know it's a greater percentage of Black, but the majority of people who die and who get COVID in this country are white. Now, there's a greater percentage of Black folk, but one of the problems we have, even in the way we announce the news and tell the news, you got to understand there's a certain segment of the majority community that think that they're not at risk here. That's to come there at the beach partying, and now they're starting to show up in Arizona, Florida, because they didn't think it was an elderly person's disease and brown and Black folks' disease, and that ain't us. So we're gonna go out here and party. So some of that arrogance, and I don't use arrogant in a negative way. It's just, they just receive some of the same misinformation that we aren't at risk, and so we can go out here and party and go to the beach and have fun. And now we're seeing the results of that.
Well, Dr. Regis, ask you a question. It seems to me that with COVID, the attitude has been similar to the opioid epidemic. As long as drugs was tearing apart the Black community, you jail them, war on drugs, beat them down, send the cops in there to clean them out. But then when it's white people strung out, oh, we have to have, we have to have mercy. We got to understand that this is a disease. Or is it me just being cynical?
No, I think, you got to understand that people don't understand that when misinformation and information about sex and race is given out, there's usually a back and forth, negative and positive. And let me give you an example of this. If you go on CNN or MSNBC or most news media, they will start talking about the effects of COVID in the African American community. They only say that it's affecting the white community even more. And let me tell you why this could be such a two-edged sword. Then they'll bring on an expert from somewhere, and he's also a brown skin, probably an Indian American. I have no problem with that. Then they go with another expert, and it's usually a person of color. So if I'm white and I'm watching all this, I'm thinking, well, maybe this disease is just people of color.
Okay.
It really is interesting how they present and who they bring on as representatives to keep talking about this disease, except for Dr. Fauci. So I think a lot of the majority community has, because of their systemic place in the society in a superior level, some of them have thought that this is not a problem for us. And sadly, they're going to find out otherwise. But I think that when it comes to African Americans, is that one of the things that has not been emphasized enough is the impact of pre-existing medical conditions and your ability to get COVID, not so much to get it, but to have a more severe form of COVID and therefore a higher death rate. And some of those pre-existing medical conditions, and in fact, I used to talk about this 25 years ago. Out of those 20 causes of death, a lot of these medical conditions are brought on by our lifestyle, not by the KKK, not by racist cops. It's by our lifestyle. And I'm gonna tell you what it is. It's who we hang out with, how much activity we have, what we eat, what our get high is. Ain't nobody forcing us to do that. Ain't no racist cop forcing us to eat a lot of fried food all the time, and for us to have diabetes and be morbidly obese. Ain't nobody stuffing no food down our face. Now, granted, I understand the impact of not having fresh food and there being food deserts. I get that. I deal with that every day. So don't come at me with that one. I understand that. But let me tell you something. If we watched what we ate, who we hang out with, what our get high is, whether we exercise or not, we wouldn't be having a lot of this problem in the Black community. diabetes, the pre-existing conditions that cause most of the problems of diabetes are in COVID, are kidney disease, diabetes, high blood pressure, and some inherent lung disease like asthma. And asthma, of course, is rampant in our community. These things or conditions make you more susceptible to a more severe form of COVID and therefore a higher death rate in COVID. So I'm not saying I'm blaming Black folks for their condition, but I'm saying if we're going to really give this discussion the time that it needs, a level of intellectual curiosity is going to make you look at every factor, and some of the factors are self-induced. So now a lot of them are not, but to be fair, we have to look across the spectrum and recognize that between poverty, lack of access, not having the luxury to do your job from home, you got to get out there in the streets to feed your family. You got, and a lot of those workers are minority, brown and Black people. So therefore, they were exposed more and got a higher load. And there you are.
So if you don't mind, can we break this down piece by piece? And then I'm going to ask you to give us, if not the whole roadmap, at least where do we start?
In terms of what?
Okay, in terms of, because I think we're both saying that it's not just something that we inherited. It's like a three-headed monster. One part of it is poverty, which a lot of people can't control. One part of it is lifestyle, which people can control. And then one part of it may be hereditary. So what I'd like to do is start off with, let's talk about lifestyle first. And here's something I'm guilty of. I do not see the doctor as I should. So I need to book an appointment with you.
Because you should.
The reason what I've talked about this when Ron Cash was the health director over in Atlantic City.
I know him well.
Explain to him. Reason why I don't go to see the doctor as much as I should. I just don't. I can't see myself just going to any doctor that I don't know, walking in there and letting them get access to my DNA, my blood. It's just something about. Well, I'm gonna throw it out there.
I'm gonna tell you what it is.
Man, the Tuskegee experiment is in my head. Like,
yeah. Let me tell you. See, you're getting.
I can't think of the name, but I have to find a regular doctor whom I trust and who has my best interest at heart. I think that's where it starts.
I think you bring up a very interesting topic, and we could have a series of shows just on African Americans and their interaction with the healthcare system. I used to give another lecture on medical disparity, and I went back in time to the first Black doctor in 17 that was certified in this country, and how the healthcare system systematically excluded Black, experimented on Black. I went through actually the studies and up through the freedmen and post-slavery and how the healthcare system failed. So, and then you have to Tuskegee and who else knows what's going on out there that we don't know about. And Black folks have a right to feel somewhat reluctant to go see docs. And by the way, the American Medical Association did a study and found out that Black patients do better when they go see Black physicians and Black doctors and Black nurse practitioners. That was done by white boys. They found out that Black patients do better when they go see a doc that looks like them. It's studied. It's in the books. Now, I'm not saying that there aren't other physicians who aren't good. I'm not saying that at all. I'm saying is that there is a level of community when you go see a physician or nurse practitioner or a PA or medical staff that look like you, that you somehow feel more as everybody would. that's not unique to Black folks, that you would feel more comfortable in that environment. By the way, the other thing is, one of the, and God, you touched on so many issues I've done a lot of research on, and one of them is this genetic predisposition to certain diseases and to early death, and why the death rate for Black men, maybe in Philadelphia, maybe is 67, 68 years old, or for white men, it may be 75, 76, and why our death, there is something going on in the Black community that hasn't been defined, and I used to call it post-traumatic stress syndrome, and it's a kind of stress, a background stress of living in a country where we have to constantly go ask for basic rights. And if you go back and look at some of the earlier readings and speeches of Frederick Douglass, Du Bois, even before that, you'll see they're similar to what people are saying today. So what does that tell you? The issues have not changed. So essentially, there's this background stress that we have of not really being fully accepted in our own country, and that, or that we're still being viewed of as the other, and we still got to go every 10 years asking other folks for our rights. That stress leads to disease. We know that that I don't care if you're Jay-Z, if you're in the wrong element at the wrong time and they can't they don't recognize you, you may get a foot on your neck and be dead. You could be Jay-Z, or you could be John Smith out there in the corner in back Maryland. We know that. And it's in the back of our mind. And if you don't think that has impact on our psychological well-being, then you're not dealing with it. Let me give you another quick example.
Okay.
One quick example. OBGYN, I'm an obstetrician, I've delivered a lot of babies. One of the most prevalent issues that we discuss in this country, because it's one of the highest cost healthcare issues in this country, is the whole issue of premature labor and delivery of premature infants, much higher in the Black community than anywhere else. It approaches third world levels. By the way, when we took out the factor for insurance, people said, well, most Black women didn't have insurance or underinsured. Nope, that wasn't an issue. We looked at higher income Black women. Some studies showed that higher income Black women had an even higher rate of premature labor and delivery than lower income Black women. So you see there's something else in the environment that is affecting us, no matter what our income level is, no matter what our economic status is, no matter where we live. And I submit to you is this background stress of living in a country that really never accepted you as full citizens. And that's what we're dealing with right now.
Okay, well, I'm not going to disagree with you, because I believe that Black people, even when we do make it, we have to deal with survivor's remorse.
Well, all these things are the Black experience in this country.
Exactly. But let me ask you this. Besides going to Reliance and setting up an appointment,
I'll get your appointment.
But for someone between the ages of 30, 50, apprehensive about going to the doctor, what would you say would be the first step to finding a regular practitioner that they can have faith in? What are the questions that they need to ask, and where should they go?
Let me tell you one thing about Black folks that because of our experience, we have a sixth sense. I think we're superhuman. We know when you're talking to somebody, especially a policeman or somebody with some authority, you can sense whether they're really hearing you or whether they're really seeing you as a person. So I would suggest that, first of all, go to members in your own community. They'll let you know where they go get care and where they felt comfortable. then I don't go visit that doctor's office. Look at the environment. Look at who his staff looks like. And by the way, once you get in to see that provider, whether it's a nurse practitioner or a doctor or a PA, if that doctor is not looking you in the eye and explaining to you, then you're in the wrong place. Because let me tell you something. To be a physician and provider, you have to have an anointing to do that. I'm not gonna get too spiritual on you. Everybody can't be. It's not. There's a 50% of the class that did well on the test, and 50%, like Lord, and most of the better docs are the ones that did the worst on the test, because the actual being a physician is the laying of the hands. You have the laying of the hand, and most Black docs back when I was in med school, when we might not have done the best on the test, but when we got to the wards and had to deal with patients, we far excelled all of the docs that I saw. The act of being a physician is laying of the hands on the patient. That's not how you take a test. And we excelled in that. So, and still do, by the way. So my question to you is, first of all, every person should have an annual physical exam. Every year you should have an annual physical exam. That's part of it starts your entree into how you case manage whatever else is going on with you in terms of high blood pressure, diabetes, or whether you don't have any comorbidities at all. I mean, you're perfectly fine. You should have a yearly physical exam, yearly blood work. And I would go to members of your community and ask them. There are people in your community who've had good experiences. They'll tell you where to go. They'll tell you who to call, and you can call Reliance, 855 Reliance. I have a virtual medical office of about 10 staff, and we answer questions like that. They're not involved in seeing patients. They're involved in managing our patients. We established a separate division of the company to answer questions, to help close healthcare gaps. Did you get your colonoscopy? Did you get your breast? That's so important that we rented new space, hired staff, went from 2 employees now up to 12. And all they do is contact patients to make sure that they're being managed properly. Now, that's where healthcare is going, by the way.
Now at Reliance, during this time period where certain doctors' offices won't even see you right now because of the pandemic. So are you open?
Absolutely.
Okay.
Reliance never closed down.
Okay.
We quickly went into telemedicine. And because of our contacts we've had throughout the years, I was able to obtain PPE, not where I think some other people couldn't get it, I was able to get it. And so we eventually went from doing 12 or 13 telehealth visits to probably doing now 400 to 500 a day. You gotta understand, I have 70,000 individual patients across the state of New Jersey. Okay. We're not a huge organization, but we're not a small one either. Okay. And so we were able, because of our size, we were able to quickly pivot to doing telehealth visits. And now our offices are fully open, fully staffed. We're seeing probably 12 to 13 patients in the office, and then do another 10 or 12 by telemedicine every day in every office. And I got 22 of them. So, and we think that's very important because you have to keep in contact with these patients. And here's another issue that's going to come up that's very important for children. Because of the pandemic, let's don't forget about the epidemic that could happen, because kids aren't, and I don't know how you feel about vaccinations, but children have a regular schedule of vaccines, especially before they go back to school. Right. And we think because of coronavirus, that parents aren't going to bring their kids in, they're going to miss their schedule. And you might see pop-ups of measles and mumps and things that we should have, maybe even polio, because people aren't getting vaccinated. But that's another whole issue.
That's definitely, we'll definitely come back on that. I should have said this 10 minutes ago. If you're just tuning in, this is The Light Live, and my special guest is Dr. John Regis, and we're talking about the effects of the COVID virus on the Black community. Okay, so let me move on to lifestyle, and lifestyle has so many branches on it. I don't get to all of them, but let me ask you this. What would be your advice to someone who is living in one of the many food deserts in in the Atlantic City area? Just get on the bus, or I mean,
Well, it's a very interesting problem. I know in some cities, Uber and Lyft used to provide either free rides or half price rides. I don't know if that's still going on because they knew the problem of trying to get inner city residents out to where there was fresh vegetables. And isn't that amazing that we got to even say that in the country as wealthy as this is? I would also look at farmers markets. They're being held in
yes,
Atlantic City now and across this county where you can get fresh vegetables. The problem is we have to understand that it may take extra effort, but let me tell
yes,
you, the last thing you want to do. I had a sister that was on dialysis. I have a brother that's on dialysis. You want to if we do a lot of extra efforts to do a lot of different things, we should make the extra effort to make sure we're eating properly. Because let me tell you, it will get you in the end if you don't. There's no question that high blood pressure, diabetes, asthma, heart disease are all out there waiting for you. And if you're Black, his net is broad and wide.
right. So here's what I will do. I do know that last time I was at an NAACP meeting, they had somebody from, I think it was Uber or Lyft. I'll find out because they do have discount rides. And then also, I know a young lady, Paige Vaccaro, who runs several farmers markets. So in the article, I'll include that information.
The other thing is the state used to have one while in Atlantic City, because I was on one committee, I've been on some committees, they were bringing around food trucks that were filled with fresh vegetables and trying to go from neighborhood to neighborhood. That was an initiative by the State Department of Health. I don't know if that's still going on. I have to check with the Department of Health and some of the commissions that I know that work there. And used to be Dr. Eleanor Harvey Lever. They actually had a program where they were putting on trucks going through the community selling and sometimes giving away fresh vegetables.
Right.
So there are resources out there, but it sometimes it's easy to go down to the local dollar store and get a bag of chips. But I'm telling you, you're killing yourself. At the end of the day, you're gonna pay the piper. It's just like smoking cigarettes. Cigarette smoking will get you in the end. I don't care what you say. If you smoke cigarettes, you're going to die from cigarette smoking. I mean, I say that it makes, oh, he had cardiac disease or he had, but you died from cigarette smoking. That's another whole issue.
Well, that leads me to my next question with regards to lifestyle. People who do smoke, use drugs, use other things because of addiction. And this is something I can't relate to because I'm not addicted to any of those things. I look the food part, I have a hard time with at times, but as far as the drugs part, that's not a issue with me. But as a doctor, what's the first step to stop smoking, or even if you have a sugar addiction, sodas every day, or what would you say is the first step to breaking those chains?
I think the first step is, as it is in most things, is recognizing that you have a problem. Awareness. And by the way, it doesn't mean that you have to be self-aware. Look around you. Look at members of your family. There's not a Black person in your audience that you know that doesn't know somebody in their immediate family that's had blood pressure, kidney disease, or was on dialysis, or died before they should have from environmental or self-exposed issues. So I think awareness is the number one thing that I know I have a problem. I know that I'm morbidly obese. I know that I'm 30 and 40 pounds overweight. Then you got to decide, the next thing is self-determination. You got to say, okay, what am I going to do about that? And it's tough. It's tough. But if you go down to states like Mississippi and Alabama, where 50 to 60% of Black women are overweight. And 40% of Black men are overweight. I mean, morbidly. You got to wonder, okay, by the way, are we doing that because we're trying to kill ourselves?
I don't think so.
Yeah, I don't think so either.
I think it's stress management.
Yeah, exactly. There's something in our living experience here in the States.
But let me be honest, and I shouldn't be dishonest.
You get into another whole issue that takes another 3 or 4 hours.
But no, I should not be dishonest. But let me tell you something. Saturday night, I'm in ShopRite. In front, they got $2 ice cream, and I'm down the street from the cheesesteak place, and I'm standing in front of the ice cream bin. I'm surprised they didn't call the cops. I'm there for a good 10, 15 minutes arguing with myself not to buy this ice cream at 9 o'clock at night. But I'm saying to myself, I love to play basketball. I can't play basketball because of COVID. I got to pick. Am I going to die of heart disease or COVID? But one of them's going to get me.
Hey, Mr. Todd, let me do this for a second. I got to pick up this phone. Let me take a quick 2-minute break. I'll be right back, okay?
Okay. All right.
Oh.
All right, Marcus, are you still there? I don't know if you missed it, but he said that his offices never closed. So before I'm out, I will ask him specifically about Atlantic City.
By the way, Mr. Todd, let me tell you, I'm going to have to in about 10 minutes break, but I love this conversation because let me tell you something. Let me just mention something to you. And
Sure.
I was thinking about sponsoring a series on my own because I don't really think with all the and I'm kind of going off topic here, but I don't really think the uprisings and the protests with Mr. Floyd and the other folks that was that and I could name names for the rest of the afternoon. We know who they are. We're not really dealing with the real issue. And I call it, it's a common term, the inconvenient truth. What is the real issue? And the next time I hear somebody say, well, we're going to ban chokeholds, that is ridiculous. What is that going to do? We're going to ban chokeholds? Do you think that a police officer, if he feels his life's in danger and is in a fight, he's not going to choke you out and they're going to arrest him for that? That is such a stupid request to me, because it really doesn't get into the real source of the problem. Okay. So, but that we need to have a conversation because I'm actually thinking about having a series on Black folks need to ask themselves some serious questions. You know, why do we keep going back to the same people, to the same authorities for the same thing, expecting a different result? That's the definition of insanity. So we got to back up and have a conversation with ourselves. And I'll leave it at that. And I know you know what I'm talking about. But anyway, let me do this because I have to go. I love this conversation because Black folks need to have a conversation with themselves and be honest with themselves about where they are, who we are, and what we're doing to ourselves. And I like to be involved in that. Whoever else wants to be involved, I don't have all the answers. But let me tell you this, after providing care for 35 years in most of the cities in this state, by the way, I have 12 offices in Atlantic County alone. So I feel uniquely qualified to speak to some of these issues. I'm not an expert, but I do have boots on the ground. And I appreciate the opportunity you're giving me to reach out to folk and to tell them that some of these stuff, some of it is their fault, some of it is not their fault. There's circumstances out there that there's a reason why we are where we are.
Right. So, okay, so before you leave,
Yeah.
I get to the third part.
Hmm.
What would be your first step? And I don't know what the answer is either, in bucking these systems that education, if I told you some of the nonsense that I go through as a member of the Black media, and for no other reason because I'm Black, you would think I was making some stuff up.
Yeah.
And yet and still, I'm still here fighting or trying to fight. So I don't have all the answers either, but in your best estimation, if you're locked into a situation because of lack of education, undereducated, lack of insurance, or being underinsured, what's the first step?
Wow, man! If I knew the answer to that, I'd be up for the Nobel Prize. I mean, what are you asking me? Really? What is the question again?
The question. Well, see, here's the thing. I think many times people continue to do what they do because they don't see any other way to do it. Again, going back to my own experience, I got into the media, but I didn't have a mentor to come and say, Ray, this is where you want to be, and I'm going to show you how to get there from where you are. So I had to strike out blind, not even knowing exactly where I wanted to end up. So for somebody who is in a situation where they have no insurance, maybe they're working a single job and all the money goes to the kids, the food, the lights, the car insurance, or the bus. And so, more insurance for a doctor's visit or paying cash for a doctor's visit may not be a feasible option to them. So, I wouldn't know what to tell them except for try and work out a payment arrangement with your doctor or.
Now there are resources out there for that, and
right.
Let me give an example. It's run by a good friend of mine named Miss Linda Flake.
Okay.
Linda Flake runs a not-for-profit South Jersey Family Medical Center. It's a federally funded community health center, which means they get funded additional funds. I'm a for-profit company.
Right.
She gets funded, and she's a very good friend of mine, to take care of patients who are underinsured or that have no insurance.
Okay.
And she's got offices in Pleasantville, Atlantic City, Hamilton. I think she's in Burlington City.
And what's the name again?
South Jersey Family Medical Center.
South Jersey Family Medical Center.
Okay. Here I am giving Linda Flake some publicity, and she's a competitor of mine because I see the same patients sometimes. And then you have Complete Care, which is another federally qualified community health center. We call them FQHCs. Complete Care is down in Vineland, Bridgeton, Millville. By the way, Linda Flake is African American, and Curtis Edwards, that runs Complete Care, is an African American male.
Okay.
These federally funded healthcare centers are set up specifically to see patients who have no insurance or they're underinsured. So there is access to healthcare out there.
This is why I asked you about first steps, because I think more people actually do want to take better care of themselves.
Yep.
Definitely want better care for their children. But if you don't know where the first step is, you can't take it.
Yeah, but you know what, Mr. Tyler?
You understand what I'm saying? Somebody has to be able to say, okay, there's a Linda Flake out there who can get you started.
Well, the other thing is, but you got to understand, some of this onus has to be on ourselves. We have to go out there and ask the questions.
Yes.
There's information out there. Everything's not going to be spoon-fed to you or come through the mail. You have to go out there and ask questions. you'd be surprised. One of the major resources you may have may be your neighbor next door, or your minister. May be a place to start. There are resources out there. I'm not saying that every question can be answered, but there's a starting point for everything, and that is to open your mouth and speak, and to ask the question.
Okay.
And with that, I'm going to have to, maybe we'll do this again, because we touched on another topic that really need to be touched on. But
well, I definitely would like to do this again, and I thank you because, like I said before, I think you've given us 3 great starting places with regards to lifestyle.
Yep.
I forgot the other 2, but
it's lifestyle. It's our workplace environment. It's who we hang out with. It's our exercise, how much exercise we should be doing, our diet, and what I guess.
Most of us know somebody who still exercise. But most of us know somebody who still exercise.
Right.
It's such a big hurdle. Dr. Regis, definitely want to do this again. And I thank you for your time. Do you want to say anything in particular before I let you go?
That we're in uncharted territory. These are perilous times. But, Black folks, we've been in uncharted territory and perilous times ever since we've been here. And we will survive this too. But I think we need to start thinking about other alternatives than to quit asking people for the same things for 400 years and getting the same answer. That's insanity. We need to start having a different mindset and start asking each other some serious questions. And that's a conversation that Black folks have amongst themselves. Don't nobody else need to be there.
Right.
And I like to be involved because I think I have some solutions, but I'll get to that later. Because I'm actually tired of going back and asking somebody to please treat me as I'm an American citizen. I'm getting tired of that. After my father fought 3 wars for this country, my brother was in the Army. I'm not going back and asking you for rights anymore.
Right. One of my people on Facebook asked, is the Atlantic City office open right now?
Yeah, I just opened up a new office. The COVID testing site or Reliance office?
The Reliance office.
Yeah, we have an office on Baltic Avenue, Baltic, Tennessee. I just remodeled a building I own there. It is open now. It has a history of providing care. It's there now. Go by there. The office manager's name is Miriam. You mentioned my name. You'll be well taken care of.
Thank you so much. Okay? Appreciate it.
Thank you. Looking forward to it. Let's talk again soon.
We'll do that. Thanks again. Take care.
Take care now.